discuss this research paper published in the Journal of Circulation in February 2020 from the National Institute of Health. This is a research letter on disparities in congenital heart disease mortality based on proximity to a specialized pediatric cardiac center. In the introduction, the authors say that congenital heart disease related infant mortality has socioeconomic and racial disparities that we know of. In the United States, specialized pediatric cardiac care centers are located mostly in metropolitan areas. So they hypothesized that a further source of disparity is the proximity of a family's residence to a specialized pediatric cardiac care center. The data was obtained from National Center for Health Statistics at the Center for Disease Control and Prevention from 2011 to 2015. All deaths of infants less than 365 days born to US residents in a given year were included. The congenital heart disease as a cause of death was determined by ICD codes. The exposure variable was defined as dichotomously based on whether the maternal residence was in the metropolitan area with at least one pediatric cardiac care. From 2011 to 2015, coming to the results, the unadjusted congenital heart disease related infant mortality rate was 0.33 per 1,000 live births. Interestingly, the proximal PCCT50, which is the subjects living close to a hospital, the mortality was 0.28 per 1,000 live births compared to those not living in a proximity was 0.37 per 1,000 live births with a significant p-value of less than 0.001. For mothers living proximal to a non-top 50 PCC, the unadjusted congenital heart disease infant mortality rate was same as the ones who were living away from a hospital. They chose the top 50 PCCs or pediatric cardiac care centers based on the US News top 50 pediatric cardiac hospitals in the US News from 2017. The mortality rates were also lower for maternal residents proximal to a PCCT50 within each covariate stratum, which included, as in this table, race, ethnicity, sex, birth weight, gestational age, maternal education, and insurance. Therefore, the study concludes that congenital heart disease related infant mortality differs by whether a mother lives in a metropolitan area with the top ranked pediatric cardiac centers. Of course, there are lots of limitations in this kind of a study, which include counting deaths with congenital heart disease as the underlying cause rather than a contributing cause, potential misclassification of variables, proximity defined as a dichotomous rather than a continuous variable, and potential residual confounding, including lack of homogeneity of diagnosis in proximal and non-proximal areas, etc. Ranking quality of care based on US World News report is also a limitation because the way it is ranked, which is mainly based on pediatric subspecialists rather than actual data, more on reputation. Thank you.